So President Obama desperately trying to save his signature achievement as president, but is the Republican replacement to Obamacare any improvement at all? Let me talk to Fox News senior judicial analyst Judge Andrew Napolitano. Welcome back, Judge.
Oh, nice to be with you. You know, I might be the skunk at the Republican garden party, but I would have voted against this proposal for a couple of reasons. It assumes the premise of Obamacare. There are four premises of Obamacare, all of which you and I think most people watching us now reject. The first is that somehow the federal government can regulate the delivery of health care.
Yeah.
The second is that somehow the federal government is obliged to provide for health care. The third is that the federal government can order you to purchase insurance for health care. And the fourth is, this is the Orwellian one that Paul Ryan's people didn't even lay a glove on. All physicians must keep all of their records digitally, and those laptops have direct access to them by bureaucrats in the Department of Health and Human Services.
Yeah, that means anyone can look at your health records.
Did the Republican legislation that the president and his colleagues and friends celebrated on Thursday or Friday of last week change any of those four things? It reinforced them.
Yeah, and
they
also
are still the essence of the law.
And also that the federal government can compel you to pay for someone else's health care regardless of whether or not they've tanked their own vessel.
So here's how the individual mandate works at the present time under the Affordable Care Act, Obamacare. If you work 40 hours a week, and if you work for somebody that has 50 or more employees, that employer has to provide health care for you. Under the new system, you have to have to provide health care for yourself. Under Obamacare, if you don't have health care because your employer doesn't provide it, or you're in the category where your employer doesn't have to provide it, you get charged for it by the IRS, and they buy a policy for you. Under the Ryan proposal, if you don't have health care, once you do get it, your insurance carrier can bill you $3,000 a year over and above the premiums for each year you didn't have it. I'm not so sure that that's an improvement at all.
It's a subsidy for insurance companies.
Correct. It's transferring money from the IRS to the big insurance companies. It's compensating them because you, a young, healthy person in my hypothetical, chose not to have health insurance at a time where you probably don't need it. A choice that a free person ought to be able to make.
Yeah, and that compulsion by the federal government only complicates a system that is so difficult even for the most ardent policy wonks to understand, let alone explain.
Whenever the government tries to regulate the free market, it becomes difficult to understand, difficult to explain, and more expensive to operate. If the federal government stayed out and allowed the states to regulate, and if you like the regulation in Texas, you can go to Texas. You prefer the regulation in New Jersey, you can move to New Jersey. As Ronald Reagan used to say, you can vote with your feet. But the one-size-fits-all that the federal government is imposing on us with subsidies and tax credits and people paying for other people's insurance and the individual mandate in there in a different form, it is unrecognizable by those who wrote the Constitution.
Absolutely, and you make a really good point, which is just some of these provisions have been renamed, but they're just as toxic, and they do the exact same thing, and that means they are going to jack up premiums and deductibles, and that's going to hurt middle and lower income earners. I
think Mrs. Pelosi has a point when she says the Republicans are stuck with this, and this is going to cause them a lot of harm politically. It doesn't serve those of us who believe in small government and that the federal government should have nothing to do with health care, and it doesn't serve their blue-collar, middle-class constituency that wants cheaper health care. The federal government can't produce cheaper health care unless it takes money from somebody and gives it to those to subsidize the acquisition of the health care, meaning they're taking it from A and giving it to B. And the Constitution simply doesn't authorize that.
That's absolutely right, Judge. And if people are upset by Common Core and the one-size-fits-all mentality there, they should be very egregious over here.